Hello everyone, welcome back to my channel. I hope everyone is doing well. So today's topic is aortic regurgitation, and let's begin with the graph and loop how it look like. So firstly, as aortic regurgitation means the valve is incompetent, means it is not closed properly. So as the left ventricle starts to contract, the valve is opened and it will start ejecting blood, and the volume will be so high that it can cross even more than 200 ml. I will explain how the volume is more than 200. So this will graph looks like this, and so it will be like this, one big loop of volume of the blood. So what happens when left ventricle starts to contract, the valve is already so incompetent, it will start ejecting blood. So there will be no true isovolumetric contraction, means as the left ventricle starts contracting, the blood will start ejaculating. So this is the loop of aortic regurgitation looks like. So now we will discuss what happens, why the volume is so high. Because as valve is incompetent, the blood which is pushed into the aorta comes back, and there is two ways from where the blood is coming into the left ventricle. One is the aorta, which is regurgitated blood, and the second way is from the left atrium. That's why the volume is so big, that is around 200 ml. So this graph looks like what is the results of that is your end diastolic volume will be increased, and your stroke volume will also be increased. So let's see for the causes. There are causes are divided into two. One is acute, second is chronic. In acute aortic regurgitation, the causes is infective endocarditis, ascending aortic dissection, and chest trauma. And in chronic aortic regurgitation, the causes are congenital, connective tissue disorders like Marfan syndrome and Ehlers-Danlos syndrome, and other causes rheumatic arthritis, rheumatic fever, arthritis, which affect large arteries. But for USMLE, the commonest cause you should remember is bicuspid bicuspid valve endocarditis, aortic root dilatation, and rheumatic fever. So now we will discuss about the symptoms, and the symptoms you will see are almost same which we see in heart failure, like exertional dyspnea, which is dyspnea on doing work, orthopnea, that is the shortness of breath when a person lie down with aortic regurgitation, and they all symptoms look like heart failure. So in this you will see the pulse will be water hammer pulse, which is that is rapid rising, rapid falling. You will feel that something is pushing your finger rapidly and going. This is the water hammer pulse. And there will be hyperdynamic apex beat that you will feel on examination. So these are the commonest signs and symptoms that you will hear. And now we will talk about murmur, which we hear on aortic regurgitation, and that you will hear in early diastole, and the murmur type is called decrescendo. So it will intensify initially and it will decrease in intensity. That is the decrescendo murmur. So now what happens in this disease course? So for example, imagine these are the ventricles, this is interventricular septum. So there will be eccentric hypertrophy. So what is the eccentric? This means in this type the muscle fiber will be added in series as opposite to the concentric hypertrophy, in which the muscle fiber are added in parallel. So what happens here, the cavity size will be increased. That's why the end diastolic volume is increased, and the compliance of the left ventricle will also be increased. And due to the increased compliance, there will also be the systolic dysfunction, because the left ventricle is so compliant that it will be unable to contract and unable to eject blood properly. So this is the end of the today's topic, aortic agitation. I hope this video will be helpful for you. Thank you so much for watching. Stay tuned.